What's going on, everybody, man? Hope all is well. It's your boy Sean P in the place to be. Like the show, share the show, tell a friend, we live. I have not shared the show anywhere, not to anyone in particular. So if you want to share the show, please do that now. I'm gonna get directly into the bill. So I just want to kind of get people up to speed with this whole public health emergency ending thing. And we want to take a look at a few sources, and more importantly, we will review this ending from an epidemiological perspective. We are going to end with very good source, and all the sources and everything that we talk about in this bill is in the description, except for the videos that I am playing for educational purposes. So with that being said, I want to go ahead and start here, and then I may talk about this particular video, and I want to make y'all a part of whatever's going on. So here we go. Let's have some fun.
So it could be the end of the COVID era as we know it. It's been nearly 3 years since then President Trump announced emergency measures meant to keep the public safe during the COVID-19 pandemic. Now, the Biden White House says it will end the public emergency declarations in May. As Nicole D'Antonio reports on Capitol Hill, there are some Republicans saying they want to see the president act now.
President Biden says in May, the emergency COVID declarations in place since the start of the pandemic will come to an end. The move will mean an end to free testing, treatments, and vaccines.
This is particularly concerning since COVID disproportionately hits those segments of the population that have the most difficulty accessing good medical care and preventive health services.
It could also end Title 42, the Trump-era policy barring asylum seekers from entering the country due to the pandemic. Some Republican-led states have already sued to keep that policy in place. The Supreme Court is set to hear arguments later this month.
The emergency will end when the Supreme Court ends it. We've extended to May the 15th to make sure we get everything done.
While many Republicans want to keep Title 42, they say the administration should be ending other pandemic emergency policies now, and plan to vote on a bill to do just that.
Mr. President, if you know it's the right thing to do, don't wait until May. Let's open our country back up again, get our economy back up again.
But Democrats say it takes some time to wind this down right.
We want to make sure that the vaccine remains accessible to people. We want to make sure that testing is available through insurance programs. Those are the types of things that we're concerned about.
Meanwhile, the House Oversight Committee holds its first hearing under Republican leadership Wednesday, looking into potential fraud and abuse of federal pandemic relief money. Nicole D'Antonio, WSA 9.
What's up, y'all? It's George.
All right, so how do y'all feel about, well, first, how do y'all feel about the Republicans wanting them to end something right now while there's still an uptick in deaths? There's an uptick in mutations of this particular virus, and we're still seeing some issues. Is May too soon? Everything says pure politics. I have to agree with you on that. There's a political battle going on right now. So do we listen to Mr. President and the White House, or do we listen to the Republicans? Who do we listen to? And who is the president listening to? Is the president leaning on science? Or is he leaning on pressure from other people that's telling him that let's forget it, man? Let's just let people die who don't want to get the vaccine. You know, let's do this. If they don't want to do that, yada, yada, yada. I mean, because if something happens again and there's a huge uptick in deaths, hospitalizations and deaths, they're going to blame him. He's going to receive all the blame for it. Sutik said more science. He said he listened to more science. So we got to be real careful with who we're listening to, and hopefully the president is listening to the right people. So here go another video. This is going to involve WHO and their response regarding the global health emergency.
And now to health matters. The World Health Organization's Director General has said that COVID-19 remains a global health emergency, even though as the world enters the fourth year of the pandemic, there is no doubt we are in a far better situation now than we were a year ago when the Omicron wave was at its peak. Tedros Ghebreyesus was addressing WHO's executive board on Monday in Geneva, Switzerland, where he noted that since the beginning of December, weekly reported deaths have been rising. The Director General remembered the 5 priorities for the coming 5 years he laid out last year, what the agency is calling the 5 Ps, which is promoting, providing, protecting, powering, and performing for health.
On Friday, the emergency committee met to consider whether that remains the case. The committee has advised me that, in its view, COVID-19 remains a global health emergency, and I agree. As we enter the 4th year of the pandemic, there is no doubt we're in a far better situation now than we were a year ago, when the Omicron wave was at its peak.
So we heard from the WHO. Let's get an extensive view of the WHO in their own news article. This is an 8-minute read. I'm not going to read all 8 minutes of it, but I just want to kind of get you out the name PHEIC, which means Public Health Emergency of International Concern. It's right here. So when I go down here and read it, you're going to understand. So there was a proceedings of meetings, and there was a bunch of people who were part of the meeting. The main concern was the COVID-19 response and all these other things. There's a bunch of legal people, some secretaries, and so on and so forth. They deliberated. All of this is in this conversation. As you can see to the right, there's other stuff regarding it. So it says, the status of this public health emergency of international concern. It says the committee agreed that COVID-19 remains a dangerous infectious disease with the capacity to cause substantial damage to the health and health systems. The committee discussed whether the continuation of the public health emergency international concern is required to maintain global attention to COVID-19, the potential negative consequences that could arise if the public health emergency of international concern was terminated, and how to transition in a safe manner. The committee also acknowledged that COVID-19 pandemic may be approaching an inflection point, achieving high levels of population immunity globally, either through infection or vaccination may limit the impact of SARS-CoV-2 morbidity and mortality. But there is little doubt that this virus will remain a permanently established pathogen in humans and animals for the foreseeable future. As such, long-term public health action is critically needed, while eliminating the virus from human and animal reservoirs is highly unlikely. Mitigation of devastating impact of morbidity and mortality is achievable and should continue to be a prioritized goal. So they move forward and they continue to talk about it. And here's some other things that I actually mentioned out that conversation. So they have some points here. It says temporary recommendation issued by WHO, Director General, to all state parties to maintain the momentum of COVID-19 vaccinations till we achieve 100% coverage of high priority groups, guided by the evolving SAGE recommendations of the use of booster doses. The key word in this very first paragraph is 100% coverage for high priority groups. Doesn't say all individuals, it says high priority groups. Anyone in the chat know who they're referring to if when you see the name high priority groups? I'll let y'all deliberate on that. Point 2 is the improved reporting of SARS-CoV-2 surveillance data to WHO, and better data are needed to detect, assess, and monitor emerging variants, indicate significant changes to COVID epidemiology, and understand the burden of COVID-19 in all regions. These are things that we know that has to happen. Increase the uptake and ensure long-term availability of medical countermeasures, right? So that's like alternatives for people through therapeutics. Maintain strong national response capacity and prepare for future events. That is always the goal of virus trackers, is to make sure the world is prepared. We were not prepared for COVID-19, and that is because the research that went into that was negated by the previous administration, and funding failed, not allowing them to continue their work to help us get to a point of defense. And so here we are in the 4th year, and we're still vaccinating people. Continue working with communities and their leaders to address the infodemic, because we are not, if they're about to end the emergency, right, we're still fighting the infodemic. And this is from the World Health Organization, acknowledging the fact that there's an online misinformation campaign that is causing distractors to not go vaccinated, and some of them end up dying, some of them end up sick, some of them end up sick and passing it on to others and potentially dying. It's a mess. Continue to adjust any remaining international travel related measures. That's key. And then continue to support research. So that's WHO's goals that came out. And these were temporary recommendations issued by WHO, Director General, to all state parties. So everyone that they talk to, all the countries on earth affiliated with WHO, that's the aim and that's the goal. So here we have an article from CNBC, shout out. I'm not going to get into the entirety of it, but as you can see from the title, it says, WHO says COVID remains a global emergency, but pandemic could near its end in 2023. And as you can see, they have the chief of WHO here, and he said remains a global health emergency, what I just read to you. Although the world is a much better place than it was a year ago, it also says that WHO has estimated at least 90% of the world's population has some level of immunity to COVID due to vaccination or infection. And the chief previously said the end of the pandemic is in sight. So people are feeling confident about that. And we got to make sure that we're paying attention to the science. So in another article here, this is the end of the COVID-19 pandemic, public health emergency, details on health coverage. This article was written on the lucky date of January 30, 2023, when everything was being announced, with a declaration of it ended in 5/11. So it says the vaccines, right, as a concern. So here we go, my bad. So it says the availability, access, or the cost of the COVID-19 vaccines include boosters are determined by the supply of the federal purchase vaccines, not the public health emergency. As you know, we are shifting toward vaccines costing you money now, when they were free to get, absolutely free to get. So what's the same as long as federally purchased vaccines last? This is the key. As long as federally purchased vaccine lasts, COVID-19 vaccines will remain free to all people, regardless of insurance coverage. Providers of federally purchased vaccines are not allowed to charge patients or deny vaccines based on recipients' coverage or network status. Although a federal rule temporarily required private insurers to reimburse out-of-network providers for vaccine administrations during the public health emergency, vaccines access will be unaffected by insurers ending these payments as long as federal supplies last. Because vaccine providers are not allowed to deny anyone a federally purchased vaccines based on their recipient's coverage or network status, and must not charge any out-of-pocket costs. All right, they're going to continue to provide at-home costs. So what's changing here? The test may become more costly for people with insurance on 5/11. People with traditional Medicare will no longer receive free at-home tests. Those private insurance and Medicare Advantage plans no longer will be guaranteed free at-home tests. So they're going to strip us of all the free vaccines. When they out of vaccine, the free vaccines, the purchase through the federal government, when we done now, you got to pay. You take a COVID test, you're gonna end up your insurance. You're gonna end up paying it on your insurance. Even if you fail, I mean, even if you pass the COVID test, you still paying. All right. What's the same about the at-home test is the uninsured people in most states were already paying full price for at-home tests, and because they weren't eligible for temporary Medicaid coverage for COVID testing services. So there you have it. Now, as far as the PCR and ranging test ordered in administration, what's changing? There's a few things. I'm not going to go over all of them, but let me let you know. Most insured people still have coverage of COVID tests ordered and administered by professionals. These tests may no longer be free, which we are, if they're taking away the free COVID tests, of course, the PCR and rapid tests, they go on to. People with traditional Medicare, there will be no cost for the test, but there could be cost sharing for associate doctors. People with Medicare Advantage or private insurance, the test and associate doctors visits both might be subject to cost sharing depending on your plan. And what's key here is additionally, some insurers might begin to limit the number of COVID tests or required tests be done in network providers. So a limitation. People grandfathered in or non-ACA compliant plans will have no guarantee of coverage for tests and may have to pay the full price. For people with Medicaid, there will continue to be free tests until September 2024, after which point state may limit the number of COVID tests or impose nominal cost sharing. Uninsured people in 15 states that have adopted the temporary Medicaid coverage option will no longer be able to obtain COVID testing services. That includes in-home testing. No cost sharing as a program is public health emergency. What's the same? Uninsured people in most states were not eligible for the temporary Medicaid pathway for the COVID test and therefore will continue to have to pay in full for tests unless they can test through a free clinic or community health. And I doubt we have free community. All right. Now, COVID treatment. So here's what's changing regarding COVID treatment. People with public health coverage may start to face new cost sharing. So that's going to be a thing. Medicaid and CHIP programs will continue to cover all pharmaceutical treatments with no cost sharing until September 2024. So 5/11 is making some significant changes. What stays the same as far as the treatment? Any pharmaceutical treatment doses purchased by the federal government are still free. So after they are no longer available, you will start seeing the charge on those. And I highly doubt that they will remain free for some time because we don't know what the supply list is and how much of that supply list they pay for and still have sheltered and available to us. So they might do a whole trick'em-ship and just, say, hey, let's make our money back. Boom, let's start charging now. So a lot can happen on 5/11. All right. Telemedicine. There's flexibilities associated with public health care via telehealth during the pandemic. They will providers writing prescriptions for controlled substances allowed to do so via telemedicine, but in-person visits will be required on 5/11. So all of that online doctoring that y'all was getting done for most people, you're going back in the office. Because of the pandemic, all states of DC temporarily waived some aspects of state licensure requirements. Oh yeah, they're getting back to that, requiring state licensure. The Department of Health and Human Services temporarily waived penalties. Those are back on the table. What's the same? Expanded telehealth for Medicare beneficiaries was once tied to public health emergency, but due to recent legislation will remain unchanged until 12/31/2022. All the private insurers is still the same before the pandemic. And the Medicaid states broad authority to telehealth without federal approval. So this goes into, a little bit more of the discussion, and it just summarizes everything that will transpire. So now you have a general idea of what to expect on 5/11, and that stuff is available to you in the description. So let's go deal with Caitlin Jetlina and a dear friend of hers, another epidemiologist, Caitlin Rivers. All right, so they tag team on this article right here. Name of the article, what ending the emergency actually means. Let me get a sip of this drink. Pour 4 and a 2. Now, the communication about ending the COVID public health emergency has been atrocious. This is coming from Caitlin Jetlina. She says, we're confused. Everyone's confused. Dr. Rivers and I have been asking a lot of questions and getting some answers. So here is our understanding of the situation right now. Really complex. There isn't one national emergency declaration surrounding the COVID-19 pandemic. There are 5. Each has different purpose for different part of the government. The 5 emergency buckets are the FDA, Stafford Act, which is FEMA, Public Health Emergency, National Emergency, PrEP Act. Together, they are responsible for hundreds, thousands, or flexibilities that we saw throughout the pandemic. For example, emergency use authorization for vaccines occurred under bucket 1. Extending Medicaid to more people happened under bucket 3. These different mechanisms created a complicated system that needs to be untangled without collapsing all at once. To help prevent this, bucket 5 are ending different times. Okay, bucket 3 and 4 are ending in May 2023. All the others have yet to be determined. So apparently, 5 is being discussed among lawyers right now. Tools. Throughout the pandemic, we've been told that we have the tools. The May inflection point seems different for different tools. Antigen tests. Supply is going to be impacted, but necessarily because of the PHE, it's dependent on congressional budget. The tests are already commercialized. The U.S. bought to stockpile an antigen test of the USPS program this past winter and still has stockpiled for the coming months. It's not clear when supply will run out. We don't have an inventory number. We don't. They might. The industry, which is the test makers, are unwilling to produce the surplus tests because the demands is unknown. And because they don't know how many of the tests that the government still has, they ain't producing none because they under the assumption. That could be a problem. So what it means for us is don't stock up on antigen tests just yet, as the tests do expire, but pick up some closer to the May deadline. So until they sort out all the confusion with these tests, and if you are taking antigen test, the experts say to wait till you get closer to the May deadline, then purchase those tests. Vaccines. All right. This is not ending. This means that COVID-19 vaccines will still be available, but available is different from accessible. Vaccines will be covered by the government until the stockpile run out. And we just talked about that. But what it means for us is this. Get your updated bivalent booster soon if you haven't already. For those of you wondering if you should get a second bivalent, we may get more clarity in mid-February during the scheduled ACIP meeting. Paxlovid. You not really don't have to worry about this, and I just skip over it. But we just need to worry about it in 2024. This is something that they're working on. This is not an issue for anyone right now. Monoclonal antibodies, right? These don't work against the newest subvariants, and pharma doesn't want to make more because the market keeps evaporating. So the most vulnerable will be less protected than before. We got to keep this in mind as you decide the precautions to take. All right, national surveillance. Okay, this will continue to some extent. Genomic surveillance, it's our understanding the wastewater program will remain for now. Test positivity rates will likely go away because CDC can't compel labs to reports. Hospitalization, CDC will still get data, but the frequency will likely slow down. Vaccine update will likely remain as CDC is working with states to continue monitoring. Pharmacy testing may go away, so you might not be able to go in your pharmacy, your local Walgreens or CVS, Rite Aid, and get tested. All right, we think that'll happen fast. The experts say so. So, or there may be some delay in testing results to expect if that happens. So this just means we basically are flying blind, short and skinny. Healthcare coverage. Look, I'm gonna skip over all of this and just tell you straight up. If you have Medicaid, your coverage may change soon. If you don't and you got insurance, they're gonna be billing your insurance a lot. You're gonna be having to pay out of pocket. We won't start seeing significant changes until April. We'll find out some stuff. All right, so national versus state versus local. To sum all of this up, states are responsible for the transition for Medicaid continuous coverage back to checks. Looks like, for example, some states will follow up with people to let them know they are missing information so they don't get dropped. Some states will update mailing addresses proactively so people don't lose coverage. Some states will do nothing. Wastewater surveillance is additionally dependent on the state or locality budget. For example, in California, the state budget for COVID funding will be axed by 90%. This means wastewater monitoring in California may reduce regardless of the CDC grant. But in places like New York, wastewater is more protected by the state. The ultimate problem, one way to think about a pandemic emergency arc is to compare it to a patient's. For example, a patient goes through multiple stages of care after a traumatic car accident. The U.S. has gone through similar stages. She gives an example of what that looks like. The concerns that people rightfully have is what happens once the U.S. leaves the hospital. It's a mess out there. Fragmented care, unfunded public health, burnt out hospital workers, understaffed hospitals, disparities, farmer making a ton of money, expensive child care, limited sick leave, leaving the hospital will mean drastically different things to different people. Some will do just fine, particularly those who are healthy and wealthy. Some people will do okay, like those over 65 who keep up to date with their vaccines. Some people will be left behind or get really sick with long COVID. Bottom line, there's still a lot of unanswered questions, and it seems like an evolving situation. This needs to be a national conversation, participate, and push. We as society need to ensure we transition not to a 2019 world, but to a new and better 2023 world. These are from your local epidemiologists. They are on a case. So again, Mr. Biden, who are you listening to? Epidemiologists still have questions and we don't have answers. And you should have expected that. Now, I do want to side on the side of caution. I do believe that he is looking at the data and he's adhering to his experts as he takes that in. He has not doubted science thus far. He followed the science last time. Him and Fauci hadn't clashed. This will be a big thing. So, yeah, we got problems with wastewater. So let's get ready to return to normal in May. I don't know what normal looks like. I think that there's a new normal out there, but I still will tell you that COVID is going to be running rampant. Now, I dropped an article the other day talking about how COVID has gave scientists an opportunity to chase down some questions remaining regarding evolution. There's a dope article would like to share, but I ain't gonna do it on this particular show. I want to kind of get this minimized and not overtalk. So again, all my stuff is in the description of the video. I appreciate everybody for tuning in. It's your boy Sean P in a place to be, and I am out.
Too legit.